Good evening, and thank you for joining us for tonight's webinar, Exercise After a COVID-19 Diagnosis with Dr. Scotty Butcher. My name is Jill Huvick, and I'm a registered nurse and certified respiratory educator with the Lung Association of Saskatchewan, and I'm so pleased to be your host and moderator tonight. As we gather here today, I want to acknowledge that I am hosting this webinar on Treaty 6 territory in the homeland of the Métis, and we pay our respects to the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. And before we begin the webinar tonight, I really want to thank all the incredible and amazing healthcare providers and lung health champions. They have certainly gone above and beyond during this pandemic, and we are grateful for all that you do. So thank you on behalf of the Lung Association of Saskatchewan. Tonight's presentation is sponsored by GSK, a science-led global healthcare company with a special purpose: to help people do more, feel better, and live longer. And I'm so pleased to welcome Marie-Claude from GSK, who's bringing us greetings tonight.
Merci, Jill. Good evening. My name is Marie-Claude Desaulniers, and I work in patient affairs and engagement at GSK. On behalf of GSK and our respiratory team, we are pleased to support this event tonight, which is part of a series of 4 webinars. GSK's mission is to help people do more, feel better, and live longer. I think this aligns to the Lung Association of Saskatchewan's mission, which is to improve lung health one breath at a time. So we would like to thank the association for this educational opportunity. COVID-19 has certainly brought a lot of health concerns for everyone, but especially for people living with lung conditions. A lot of questions. So I hope that tonight those questions will be answered. Thank you very much, and I wish you a very nice evening, and I'm passing it back to you, Jill.
Thank you, Marie-Claude. Tonight's presentation was requested by the Lung Association of Saskatchewan's COVID-19 support group members. Our online COVID-19 support group provides information that is up to date and evidence-based. It also provides educational opportunities like this one tonight, and it gives you a safe place to share your journey with COVID-19. If you are not a member of our Lung Association of Saskatchewan's COVID-19 support group, we invite you to join us by simply visiting our website at lungsas.ca to find out more. COVID-19 has certainly impacted all of us, and it continues to do so. There is so much great information about how we can protect ourselves and prevent COVID-19 by getting our vaccinations and following public health measures. Unfortunately, many of us don't know what we can do to help ourselves and our loved ones, however, once we've had COVID-19. And we hope that tonight's presentation will help everyone breathe a little bit easier and do just that. Following the presentation tonight, there will be a question and answer period. So if you have any questions, you'll notice in the control panel on the webinar software that you can type your question into the question chat feature. Don't be shy. If you have questions, ask them. Chances are someone else has the same question as you. So now it's my pleasure to introduce our speaker tonight, Dr. Scotty Butcher, and he has quite the bio. Dr. Scotty Butcher is an associate professor in the School of Rehabilitation Science at the University of Saskatchewan and the founder of the Strength Jedi. He holds a Bachelor of Science in Physical Therapy and a Master's of Science in Kinesiology from the University of Saskatchewan. He also has a PhD in exercise physiology and experimental medicine from the University of Alberta. Now, this is impressive as well. He is certified as a registered clinical exercise physiologist, a CrossFit Level 1 trainer. Now, that's some tough workouts. And he is formally certified also as a certified strength and conditioning specialist. Most recently, Dr. Butcher has also been certified as a mindfulness and meditation teacher, in which he incorporates into his research and into his everyday practice. We are so grateful to have him present tonight. Please welcome Dr. Scotty Butcher.
Hello, and good evening, and welcome to my webinar. I'm very, very happy to be here to be able to present to you on exercise after a COVID diagnosis or a suspected infection. And this is the reason I added this little bit in is that we do know that there's a large proportion of individuals who never had a chance to get an actual test, or their test was deemed negative at some point in time, but they still have the symptoms. And I think that this presentation is appropriate for both those that were diagnosed and those that had a suspected diagnosis as well. So I'm Scotty Butcher. I'm a physical therapist and associate professor in the School of Rehabilitation Science at the University of Saskatchewan, and a registered physical therapist. My contact information is here. I'm always very happy to entertain emails or connect through social media, as you can see in terms of some of the content, or if you have questions after the fact, or to follow to see some of the resources as they develop. So feel free to do that. Before I really get started, though, I want to give a couple of special thank yous. First of all, to the Lung Association of Saskatchewan for the invitation, and thank you, Jill, for the introduction. And I'm very, very pleased to be able to be working with the Lung Association. I got my start working in rehab and in pulmonary rehab, and there was a very strong affiliation with the Lung Association. So I've known many of these folks for a very, very long time, and they're very good people to be working with. And so thank you very much for having me. And then thank you to GSK for sponsoring the webinar, and I hear there's people in attendance from GSK, so welcome, and thank you for joining us. Okay, so right into it now. What is long COVID? There's lots of different definitions out there, and lots of people have lots of different opinions as to what this is and what the impacts are. And you're going to see several terms. For example, long COVID is the one that's most accepted right now, but you've also probably heard long haulers. Over here is also post-COVID-19 syndrome. And then all of the rest of these words are basically any of the symptoms that you might end up having that contribute to this, or that are developing from this. But I want to start by just giving you a little bit of an overview of why it's called long COVID and where a lot of this comes from. Now, I'm not a virologist, and so I'm not going to pretend to tell you a lot about how the infection actually specifically impacts the organs. I am a physical therapist, and I'm trained in exercise prescription and exercise physiology. So I'm really going to relay this presentation to you in terms of what I know about exercise prescription and the exercise type responses. And so that's the approach that's going to happen here. But as you can see on this particular graph, this is one that's very, very common in presentations that you might have seen related to long COVID, where we do know that your exposure happens a little bit before symptoms happen. And so you have exposure, and it might be 1 or 2 weeks before you start developing a lot of symptoms. And in these sort of range, in this first week of symptoms, is where we say you're PCR positive, which is if you were to go get a COVID test, you would test positive. But you can see that the viral and infection and the virus impact happens in the nose and the throat, and you still can have symptoms sort of going on to the week 4, but usually most of these initial infection-related symptoms will decrease or be completely gone after the first 4 weeks or 28 days. But beyond that, there's a subgroup of individuals who are likely a lot of the individuals in this call that continue to have symptoms beyond the 4-week mark or beyond the 28-day mark. And these symptoms are deemed to be considered post-acute COVID symptoms, and this is where the definition of long COVID comes in, where you have symptoms beyond that first 4 weeks. Now, interestingly, there is no correlation between how severe you got the initial infection of COVID and what your longer term symptoms are. So some individuals didn't even have anything more than a mild runny nose, but now have more severe symptoms in the long run. And conversely, there are a significant number of people that have gone into having an ICU stay or being hospitalized with fairly severe symptoms, but then their symptoms are gone and they're just really left with some deconditioning. So I'm going to talk later on about those different subtypes of individuals in terms of their COVID diagnosis, and talk about how that fits into the rehab world and what you should try and look at when you're thinking about your options for exercise prescription. So what are some of these long COVID problems or symptoms that occur? And well, in this particular slide, you can see that there's lots of individual symptoms. And this is really one of the big key points to take home in regards to long COVID, is that not all symptoms are present in everyone, and not everyone has all symptoms. So there's upwards of 200 symptoms of long COVID that have been documented, and everybody has a different presentation. And sometimes some of them will hit you sometime, some of them, and then go away, and then you get other symptoms later on, and then maybe those initial symptoms can't come back. Some people were infected early in the pandemic and are still exhibiting symptoms. So these symptoms can last well beyond 6 months to a year, and we're going into a year and a half at this point, where some people still have symptoms. And these symptoms could involve anything related to fatigue or dyspnea, which is shortness of breath, anxiety or mental health concerns, heart concerns, palpitations, chest pain, kidney issues, blood issues, hair loss, taste, eyesight problems, a multitude of symptoms that can happen. We're going to focus on the ones that are relevant for exercise prescription. So another way of looking at this, and this was a figure that was put together earlier in the pandemic, and this represents the sort of normal course of someone who has had to go into a hospital stay. And so this is the one that I think we know the most about. The longer or the long haul symptoms, or the long COVID symptoms that involve long lasting fatigue. I'll talk about those later, but those are the ones that are not as well known, and certainly there is much less research out there in regards to what to do with individuals in that case. So let's start here. So after a COVID diagnosis, you might have someone who's admitted to the hospital, and then they have, because of the COVID attacks many different organ systems. And so you could have an impact on your muscle, it could be an impact on your lungs, as you see here in this graph, could be heart, could be brain, could be kidney, many different organs that the COVID has been known to affect. And in many individuals, this leads to needing an intensive care unit stay, where they have some time where they have to be put on a ventilator or stay in the intensive care. We know that any sort of hospital stay, and particularly one that involves an ICU stay or intensive care stay, results in what we call ICU acquired weakness, or post-ICU syndrome. And this is really a weakness that is involved with reducing your capacity. So it's basically saying that whatever your level of activity is now, you reduce it down to complete bed rest, and you become very deconditioned, or very out of shape, to put it in lay terms. So you have a lot of issues related to that inactivity, but the good news in this case is that we do have a sense of how to rehab individuals that have gone through these issues, and I'll talk about that in a minute. But that deconditioning also leads to a very poor spiral, unfortunately, that we can see, that often we see isolation if you don't have good social support or anyone to take care of you, which results in further inactivity, depression. Sarcopenia is the reduction in muscle size and strength, and so this is one of the key determinants of how someone does after an ICU stay, is how well they can maintain or regain their muscle mass. But if you lose a lot of muscle mass, that leads to frailty, which is more isolation, and so forth. So I'm going to show you a picture here of an actual individual. This is Mike Schultz. This was on his Instagram page, where he was posting about his ICU stay, and he was posting about the problems that he had. And you can see that he was a very muscular, fit young man. He was someone who was actually a nurse, or is a nurse by profession, and obviously enjoyed working out. And he was in the ICU for greater than a month. I believe it was close to 48 days, if I remember correctly. And he developed a significant amount of sarcopenia. And so this is the weakness and the loss of muscle mass that you see here. And he described it as that he was so weak he couldn't even hold his phone for the first few days after recovering. His phone was so heavy he couldn't type because his hands shook so much, and you can see obviously the effect that it had on him. Now he has since gone on to restart his training program and start exercising, and he's been able to use a progressive exercise program to basically return to his prior state. So this is some good news that for individuals that are in this particular cohort of individuals with long COVID, that he still had symptoms of weakness and lack of muscle, but he was able to build those up. And that is fairly common in individuals that have had that acute stay. Having said that, probably one of the reasons he survived it is that he did start at a really high level of muscle mass. And there is some good research now to show that the more muscle you have going into an acute care stay with COVID, you'll still lose lots, but you have some reserve, you have some room to keep losing. And so if I can say anything is if you don't have COVID and you're trying to prevent some of the long-term consequences, other than getting vaccinated, which we know the science is very clear on that helps with mitigating some of the symptoms. Also, exercise. It can be very good for you, just not just for prevention, but obviously for your overall health. So let's go into some of the lasting impact of these individuals with some of these cases of long COVID or that have been in hospitals, and what some of the concerns that they can have, and some of the damage that happens. And so, like I said earlier, that there's many systems that are affected or that can be affected with a COVID diagnosis, and most of these are acute symptoms. So symptoms that happen during the first 4 weeks or the first 2 weeks of diagnosis. But then there's a significant number here that maybe, again, as I said earlier, their initial diagnosis, their symptoms were fairly mild, but then they go on to have things that are related to, say, arrhythmias and palpitations. They might still have some shortness of breath and low blood oxygen, joint pain, muscle weakness. We're going to talk a lot about this malaise or fatigue that's associated with long COVID. Anxiety and depression, this can be a very concerning disease, a disease where there doesn't really seem to be a lot that can help a lot of the long haulers, and so that can have a very significant impact on mental health. Memory problems, smell problems are very common. And hair loss, rash, things like that can be very, very common moving forward with long COVID. So how many people have each symptom? So thinking about the long COVID diagnoses, if we kind of have a look, we can see that the biggest symptom that's associated with long COVID is fatigue. And this is one of the more debilitating symptoms, unfortunately, for those individuals that have what we call post-viral fatigue. And again, I'm going to talk about that cohort later. But even those individuals that did have an ICU stay or a hospital stay and don't have the post-viral fatigue, they're still going to be tired because they're weak. And like you saw with our nurse, Mike Schultz, is that it's because of a lot of the reason is because of a decrease in muscle mass. And that decrease in muscle mass and muscle strength reduces your ability throughout your daily life to perform regular activities. So fatigue is going to be a common symptom across all of these different subtypes. But then there's a ton of other symptoms as well, headache being one of the more common ones that individuals have. But as you can see, well over 10% on many of these other symptoms are prevalent. But again, not everybody gets all of them. So palpitations, joint pain is quite common. and lots of other issues that come into this. So you might recognize some of these symptoms as ones that you have had, and maybe you still have or have been newly developing if you have long COVID. So I did mention before that there are different types of long COVID, and I've talked a little bit about which each of those are. And I think there really needs to be different rehab strategies depending on the type that you have or the type that you're exposed to, simply because the response to exercise differs depending on which type you have. Now, I will say that there is, because COVID is obviously a fairly new disease, long COVID even newer than an initial COVID diagnosis, and there is research coming out. There's very, very little in terms of the research that tells us exactly what to do. So we're making a lot of assumptions, and we can use some of the guidelines from other diseases that kind of mimic a little bit of what some of these long COVID presentations would look like. And we can borrow some of the techniques that they have to look at how would we rehab these individuals. And so I'm going to go through that right now. So the first subtype is someone that has been in the ICU or even a significant long-term hospital stay. As I mentioned before, one of the biggest problems with them is this ICU acquired weakness. You get very, very weak, and it takes a long, long time to rehab and recover. The good news here is we have been successful in rehab and healthcare in taking individuals who have had this and to be able to use a progressive exercise program and build them back up to a greater state, and hopefully to at least their prior level of abilities. Okay, and we would do that through a long-term progressive exercise program. Another subtype is organ damage, and so this one is where you might have the most impact of the COVID virus was on the heart. And so you would think, well, if I have some heart damage, I should see a cardiologist and I should go through that pathway and then potentially go into cardiac rehab. Or potentially lung disease, go see a lung specialist and go into pulmonary rehab. And so this is also a very known quantity. And this is a picture taken from the Lung Association website of some individuals undergoing pulmonary rehab, which involves a lot of walking and some progressive strengthening type exercises. And this again is for these individuals, this is again a fairly known commodity if they're having symptoms that are associated with damage to their heart or their lungs or their kidneys. Is we do have rehabilitation programs that would likely be appropriate for these individuals. And so you would need to go through your doctor and potentially see a specialist and then asked to sign up to one of these known programs, which are very, very good. And if I'm familiar mostly with what's in Saskatoon, and the Live Well programs in Saskatoon are fantastic, and I'm sure wherever your center is, you can find access to individuals that can help you. One of the other things that I did mention a little bit before is the impact of resistance training. And in both of those subtypes, the ICU acquired weakness subtype and the organ damage subtype, resistance training is something that I think is underutilized and something that would really benefit most individuals. So you can get this through a formalized rehab program if that's something that's needed because of the organ damage. Or if you feel that you're simply deconditioned, there are lots of good trainers and gyms that can help you do this. But there's lots of benefits associated with resistance training, and some that you might not associate with resistance training, like greater aerobic abilities or endurance, like this greater oxidative capacity that you see there. And that's one that isn't really well known, but definitely is something that can help. And it can also help with other things like body composition and your blood pressure and blood glucose or diabetic type symptoms. Okay, moving on to the third one. Now, because we know more about those first two, I'm fairly confident in saying to you, if you think you fall into those first two categories, talk to your doctor and see a specialist that's associated with whatever your symptoms and concerns are. And I'm thinking that joining a rehabilitation program is going to be the most appropriate way for you to progress. And so I'm going to leave it there, and I can certainly answer more questions about what to do in those situations. But where I want to spend a a lot more time on is this third category, this post-viral fatigue category, because it is one that is way less known in healthcare, in rehab programs, and even with your medical providers in terms of what to do and how to diagnose this type of concern. And so, if you've heard of this before, there's post-viral fatigue. You might have also heard of post-exertional malaise or post-exertional fatigue or symptom exacerbation. The key difference here is you should not be using progressive exercise if you are in this category. There's a strategy called stop, rest, and pace, which I'm going to talk about later, that is the strategy that you should think about using and talk to your healthcare provider about how to do. Again, there's not a lot of research associated with this in long COVID, but there is a subgroup of patients that have had this from other viral infections that develop chronic fatigue syndrome. And there's a term called ME, or myolytic encephalomyelitis. There we go. Took a second or two to get that right. Where chronic fatigue type syndromes, including potentially fibromyalgia and other chronic fatigue syndromes, have really learned that progressive exercise isn't going to work for them, and that they really need to learn pacing strategies. And so I'm going to talk a little bit now about how to approach this type of rehab, or how to approach these type of exercises. But certainly I would say that this information that I'm about to provide to you might not be appropriate for you to say, oh, I can just go and do it all myself. But this is good information to take to your healthcare providers and to, say, a physical therapist. And I'll put a plug in for physios, given that that's my profession as well. Physiotherapists are very well trained. Occupational therapists are also very well trained. Exercise therapists with the right information. All of these professions can come together and hopefully help you. But really, this post-viral fatigue, I don't want you to confuse this with I'm tired. It's a very different sensation, and it's a very different type of diagnosis that, oh, I did some exercise and now I'm a bit tired afterwards. That is not what we're talking about. That is the norm for many people. They do some exercise and they might feel a bit tired afterwards. And actually, in many cases, if you do some light intensity exercise, you'll find that even you feel better after exercise. For individuals with long COVID that have post-viral fatigue, this is not the case. Even a little bit of activity or energy expenditure or mental energy, anything like that can cause what we call a crash. And this isn't, oh, I just want to sit down for a bit and just rest or put my legs up. This is, I can't get out of the couch, or I can't get out of bed. It's just mentally and physically exhausting and draining to even do basic daily chores, even to get up to have a shower, or to get up to go to the washroom, or to eat. These things become these very, very significantly impaired activities. So this level of fatigue is not, again, I'm just tired from exercise. And that's a very crucial consideration. And I'll talk about some of the key diagnostic factors in a minute. Okay, so what is this? What are we really talking about with long COVID? Let's talk a little bit about some of the definitions here. And so some of this I've gone through a little bit, but I just want to provide a touch more information. Again, we're talking about 12 plus weeks, okay? How common is it? It's about 1 in 10 of those with COVID have long COVID symptoms. And again, this is of the 12 weeks or longer that this would happen. Often this can happen in previously fit individuals. Children as well can have similar type of concerns. But as I mentioned before, some of the big factors here is that there are 200 listed symptoms, over 200 listed symptoms that can happen in varying combinations and are often predictable and unpredictable patterns. So you may find that, 6 months, and this is very common with patients, 6 months down the line, they develop a new symptom that they didn't have for the first 6 months. And that is something that does happen with this disease, okay? So moving forward, if we look at individuals often can experience either mild or severe symptoms. So even if you did have mild symptoms, as I mentioned before, you could have severe long COVID, and even some individuals with severe COVID symptoms on diagnosis and on infection can go on to have these long COVID type symptoms. Again, the most common ones after 6 months are extreme exhaustion or fatigue. Again, just not being a little bit tired. This is extreme. This post-exertional symptom exacerbation or post-exertional malaise that I mentioned before, very common. And often these two symptoms are associated as well with problems with memory, concentration, or the so-called brain fog. And so these symptoms are very, very common, but again, not necessarily purely diagnostic of long COVID. You could have other symptoms and maybe not one of these ones, but usually it's that extreme exhaustion and post-exertional symptom exacerbation that really defines the long COVID presentation that's associated with post-viral fatigue. Okay, many other symptoms as well. And so I've listed them before, and here's just another really nice infographic. And incidentally, I'm just going to mention where these infographics that I'm presenting to you come from. World Physiotherapy Day was September 8th, and their focus this year on education around physiotherapy was on long COVID and long COVID symptoms. And so they've developed this really nice series, which I'll link at the end. I've got the resource URL or the website that you can go to where you can take these type of guidelines and take to your provider, your healthcare providers, your physicians, your therapists to say, well, this is what I think I have, and how do we go about managing that. Okay, let's talk about rehab, and particularly in terms of exercise type rehab. Okay, so rehab, as we know, is a multidisciplinary approach to treating any sort of disease or injury or problem. In the case of long COVID, of course, this is usually considered to be a chronic disease. And we know that recovery from long COVID and many, many other diseases that we've mentioned that are similar to long COVID are a very fundamental part of recovery. And so the big thing, again, is that there isn't a one-size-fits-all rehab program that fits every individual with long COVID, as I mentioned in the previous slides. So really look at which type of long COVID you think, which category you fall into. Take that information to your healthcare provider, and they can do the appropriate assessments to see if you're right, or to confirm your suspicions, or to present maybe a couple different points of view in terms of where you might be. So it really is individual. And so you can't look at Joe Blow, who had long COVID and he responded well to exercise and to follow his program, and because that very much might not work for you, and as you'll see in a minute, might be actually dangerous for individuals with post-viral fatigue. Okay. What do we, when we think of rehab, again, there are the different sort of classifications that you can see, and that's sort of highlighted again that you can take to your therapist or healthcare provider and look at some of the differences that you might have to do for rehab. But in terms of thinking about your self-management, and so I know a lot of people will think, well, I can't, I'm not near a rehab program, and so how do I manage this? I think a consultation with a healthcare provider to help you with understanding the potential interventions that you can do to help guide your rehab in terms of activity pacing and heart rate monitoring could be very, very useful for you, and in terms of being able to progress your programs appropriately. So we're going to go into the activity pacing because that's the most common one. If you want to look at heart rate monitoring, that one is usually best done in consultation with an exercise professional who can measure your heart rate at different levels of exercise. And we typically look at the heart rate associated with the anaerobic threshold, which is a very complicated medical term for meaning the highest intensity that you could sustain for, say, 20 minutes, 30 minutes without having to stop. That would be sort of your top end. That would be your anaerobic threshold or your top end. And the heart rate monitoring would help you identify where your heart rate is at that top end and help you to stay below that. And that's one of the most effective strategies that individuals can use as part of their pacing strategies if they have this post-viral fatigue. So talk to your professional about that, and I can certainly answer questions if you have them. Okay, and then the other thing is that not only just from an exercise prescription perspective, your healthcare provider can also help you if you have some of these symptoms, which may or may not be associated with your diagnosis of long COVID or a post-COVID syndrome. There's lots of different tests that can be done to determine, is there anything else going on? Is it, if it isn't long COVID, is it, you know, something to do with some other chronic disease or acute disease that you need to be concerned with? So they can do that sort of diagnosis. Okay, so I've talked about post-viral fatigue and this post-exertional symptom exacerbation or post-exertional malaise that it's called, PEM or PESE. Let's go into a little bit more about what that is, and then I'm going to talk about how to design a pacing strategy along with your healthcare professional to help you understand what to do here. Okay, so what is this fatigue that we're really talking about? Again, this fatigue isn't the basic I'm tired. This is a feeling of extreme exhaustion. It is the most common symptom of long COVID. This fatigue is not easily relieved by rest or sleep, which often can happen if you don't have this post-viral fatigue or post-exertional symptom exacerbation. If you've done some exercise and you feel tired, take a rest, see how you feel, right? And then you'll probably rest will help, sleep will help. In the case of someone with post-viral fatigue, it is not relieved by stress or by sleep or rest. It usually is not the result of unusually difficult activity. It's usually your basic activities. Maybe you just did something a little bit too hard, not like you've gone and done a really heavy CrossFit type workout. This is you've done something a little bit too much in your day, okay? And this is the fatigue that it's associated with. It can limit function, and in many individuals limits your day-to-day activities, so that what you'll find is that you'll try and get through your day, which we sort of call the pushing. So you push through your day and then you hit a point where you crash. I'm going to talk about the crash in a minute, but what a lot of individuals will do is push through their day. They get only a certain amount done, and then boom, they can't do any more. Okay, that's a very, very common symptom or pattern of activity limitation that you'll end up seeing. And in many, many individuals, this can really negatively impact their quality of life, of course. If you're not able to do the things that you enjoy, including exercise and other physical activities, and you're having difficulty even with your day-to-day activities, your quality of life and your mental health can have a really significantly negative impact. Okay. Let's talk specifically about this post-exertional symptom exacerbation, again, also known as post-exertional malaise or as a symptom of post-viral fatigue. So again, this is the disabling and often delayed exhaustion disproportionate to the effort, okay? It's sometimes described as the crash, as I mentioned. The activity can be really anything that was easily triggered before or that easily tolerated before, and this trigger that used to be tolerated, again, like I mentioned, can be usually just a usual activity like a shower, social activity, walking, you know, other types of exercise, reading, writing, working at a desk, an emotional conversation, a really strong mental effort, or being even in a sensory environment with loud music or flashing light. So it's that emotional or mental or physical effort that should have been okay in the past. Since you've developed long COVID, this causes a crash, okay? So we talk about this term push and crash, and this push and crash, we really need to work hard to try and avoid, because what'll happen is it'll often be the crash happens maybe 2 or 3 days later, but that crash can then last months or even years, as in terms of what we know. Some people are still in their crash phase when they had this push and crash early in the pandemic. And so it's unfortunate that, this isn't something that you can treat with exercise, right? This is something where you have to think about energy conservation. And I'm going to show you what that means when we talk about pacing in a bit. Okay, so what about these triggers? So again, it's physical activity and exercise. Again, most individuals, it's beyond 6 months that they still experience these symptoms where they push and crash. And again, some other types of things that can also contribute to the worsening of exertion, disabling fatigue, brain fog, pain, breathlessness, Heart palpitations is a really common one. Sleep disturbance, exercise intolerance, and these symptoms, again, don't usually start immediately. You might get tired and crash, but then you might be able to go throughout your day a little bit feeling kind of tired, but then when the 12 to 48 hour mark hits, this is where your fatigue puts you basically on the couch, in bed, and you have very, very difficult time getting up and get moving again. So again, as you can see, this fatigue that you get is very, very different than the fatigue of being deconditioned or doing a heavy workout. This is day-to-day activities where you shouldn't be fatigued, and you're getting fatigued and it's lasting a long time. So what's the strategy? Okay, so I mentioned stop, rest, and pace near the beginning of this presentation. And this is where your healthcare provider can help guide you in this pacing strategy. So what we need to do to start with is to stop the push, right? The push then crash needs to be something that is avoided in almost all cost. This can be very, very, very dangerous to push because that crash has been known to actually put people into the hospital, and people have in the past died because of that, the crash that happens. It's not super common that happens, but it is one of the sequelae that can happen with this push and crash. And so we need to stop thinking about progressive exercise. You need to stop thinking about, oh, I'm trying to get everything done in my day that I need to do, right? Overexertion can harm your recovery. And you need to understand that, and you need to think, okay, well, what am I going to need to do to be able to function in my daily life? And so you might have a list of activities that you need to accomplish, things you need to do, and learn to prioritize which ones are the key ones. Maybe spread them out through the day and say, I'm going to do one, I'm going to do it nice and slow. Let's say it's going to get groceries. I'm not going to try and do any heavy lifting as part of that. I'm going to come home and I'm going to take a break. Okay, instead of saying, well, what I did in the past is I'd go get groceries, and then I'd go run some more errands, I'd go pick up, whatever it happens to be, and then do a bunch of other errands. And so that could lead to the push and crash. So think about prioritizing and spreading your activities out, giving yourself lots of rest, which is the next strategy. It's the most important management strategy. You do need to rest, and it's not the rest that's associated with a crash. I'm trying to say that you need to spread your little bits of activity in with rest. And that's going to be the biggest thing. Don't wait until your symptoms are present to rest. So you might say, okay, well, I've learned how to pace and I've learned how to prioritize, and, I'm feeling pretty good today. So what I might do is, I've gone to the, my cat's get my cat in the picture, and now she's out of the way. I've gone to the grocery store and I'm feeling pretty good. Maybe I could go run those other errands. The idea with this is that because your symptoms fluctuate day to day and they're different, is that could be a particular day where you're feeling better, which in a normal situation, I'd say, hey, I'm feeling good, let's go exercise more, or I can do more. With post-viral fatigue, you do not do that. Don't go out and say, okay, I'm feeling really good, I don't have any symptoms yet, I'm not feeling fatigued, I'm not getting that brain fog, I'm not getting that weird ringing in my ears that I get, or whatever your symptoms are. Say, okay, I need to rest so that I don't get them, because often that's what happens is you have a good day, you do a little bit more, that's the push, and then you crash a couple days later. Okay, so that's what we're trying to avoid. So don't wait until you feel your symptoms to rest. And then pacing your daily activities and your cognitive activities. So slowly throughout the day with lots of time to rest. Don't try and do everything at once. So this is the approach that is determined to be the most safe to navigate your triggers to your symptoms, but still be able to get life done. Still be able to do some of the basic things that you need to do. And honestly, what you do need to think about is you need to think about potentially, if your activities are too much, saying, well, you know what, that errand can wait till tomorrow, or that I can get my son, or I can get my husband, or whatever it happens to be, wife, friends, to go do that for me so that I can get the rest that I need and I can pace appropriately. So how to use pacing with your physiotherapist. So there are 5 strategies here that are sort of outlined, and I'm going to go through each of these one by one, and I'm going to explain a little bit more this concept of having sort of within your energy envelope, or having a certain amount of energy that you can use within a day. So these first two are related to that. So it's learning about your energy reserve is the first one. So it's how much energy you have each day. And again, you're going to have different levels of energy each day. So it's a really good idea to find out what they're calling your baseline. And so what that is basically your lowest or maybe even your highest level of activity that you could do within a range of feeling comfortable without symptoms, even on your worst day. So it should be what you can do, what you can tolerate, even on your worst day. And that'll give you a sense of what your baseline is. And that's what your energy reserve is kind of safe to be, because you don't want to assume that you have the same energy reserve that you have on a good day, because you won't do that every day. Learn how much energy you have on any given day. So what is suggested in this particular case is to use a symptom diary, where you track your activity and your symptoms. I'll show you an example. And again, the website that I'll link you to has examples of what this would look like. And here's where you say, okay, well, today I did these activities and I felt really good. I didn't really have any symptoms. Then you go to the next day. I did the same activities, but it wasn't as good of a day. So maybe you develop some symptoms. And so what you can do over time is you can start to see, well, what is that bottom baseline? Like if I do groceries and, mow the lawn and, a few other things, that's too much. So I need to think about, well, maybe I don't do groceries and mow the lawn. Maybe I just do the dishes and the laundry or something, and you get to learn your own energy reserves and your own energy on a day-to-day basis. And really, again, we're trying to avoid that crash. That crash is something that we're really trying to avoid with these strategies. So what was described to me at one point in time by a patient that I spoke with that had post-viral fatigue symptoms is, some people call it an envelope or an energy envelope that is sort of a total amount. I like to think of it in terms of a jar of marbles. So every day, think of it this way, every day somebody's going to give you a jar of marbles, okay? In that jar, those marbles represent the energy that you need throughout your day, or the energy that you have available to you throughout the day. Some days, you're going to have a full jar of marbles, but you're not going to know it ahead of time, right? And you might even not know, that jar might seem full, but it's not as full. But it might surprise you a little bit to think, hey, I'm feeling good, but then maybe your crash would happen a little bit sooner. So if you do end up having a lot of marbles, you might be able to take those marbles out. But if you don't really know where the end of those marbles are, then it's going to be a difficult time for you to manage your symptoms and avoid the crash. A different day, they might give you another jar and it has very, very little marbles. And so if you have very few marbles, what ends up happening is then, of course, you start reaching and you run out a lot sooner. So the idea is to try and find this minimum, right? With your symptom diary is trying to find that minimum. So on the days that you have a lot, that's good, right? You're well within your reserves and you're not going to crash. Remember, don't use them all, right? You need to learn to try and use the marbles that you have available, but definitely save some for the next day and not to be able to have that crash, okay? So on the days that you don't have a lot of marbles, you can conserve a little bit more and you're not trying to push a little bit too heavily. Okay, back to this. So strategy number 3, once you've figured out what your energy reserve is to learn how to use the 4 Ps. And this is what I mentioned in terms of prioritizing. So think about what you really need to do in a particular day or a week and prioritize those activities. Are they all necessary? Can somebody else do it? Can I change it so it's easier? Can I spread them out through the day or the week? Those are really important questions to answer as you prioritize. Plan the main tasks for the day, okay? Plan your rest time so that your day is paced. So prioritize, then plan. And then break your activity into smaller, more manageable tasks with rest breaks. That is the pacing strategy, okay? So those first 3 Ps are important in terms of avoiding the crash. The fourth one is in terms of your general health. I mean, this can be a very serious, debilitating disease that is very frustrating because what you're used to doing doesn't work. Exercising, activity, staying healthy doesn't work to avoid your symptoms. So spend some time doing some things, plan throughout your day something you enjoy, something that might take a little bit of energy, but not a lot. Pace it out and see what that can, how that can help you throughout your daily life and give you a little bit of an enjoyment. Okay, number 4, Learn how to save energy. Learn to say no. Say, I can't do this at this point because I know that that's going to push my energy marbles. So I'm not going to be able to, I don't have enough, or I don't think I'm going to have enough for that. So learn to say no. Modify your activities to use less energy. So, you know, if you previously did something standing up, can you sit down to do it? You know, or lie down, or can you do less of it? Is there some more efficient way to get things done? Avoid the temptation to just do a little bit more. Oh, I'm feeling good, I'm just going to do a bit more. Again, that could cause a push and a crash that you're not anticipating. So even if you have a good day, it is absolutely imperative that you think about avoiding the crash, even when you're feeling good and you think you can do more. Take shortcuts, ask for help, you know, anything to make things more efficient. Number 5, again, one of the most important strategies is learn to rest between activities. Rest means absolutely minimal activity and little or no mental stimulation. So don't sit down and do a really difficult crossword puzzle as part of your rest. What you need to do is you need to think about this idea of complete rest, okay? It might be vegging in front of the TV or on your phone or what have you. One key question, and this is the challenge, because you know there's that two sides of the rehab spectrum that I mentioned earlier. There's the side where you can progressively exercise and it'll work well, and then there's the side where you can't and it doesn't work well. Well, our experience in the research is very, very new, and we don't have a lot to go on other than the experiences of others with ME or CFS or other types of post-viral fatigues. But what we are seeing with COVID, long COVID, is that some individuals are getting what they call turning a corner. Some individuals are getting to the point where they just keep pacing, and then they keep looking at what they're doing. They're feeling really good. Maybe a week or 2 weeks goes by without any symptoms. And then in working with their healthcare professional, they might say, okay, I've gone 2 weeks. I haven't had symptoms. I'm feeling really good, other than the fact that I'm not doing much. Can we just a little bit try and increase and then pace at that new strategy and see how it goes? Again, not increase big. We're not talking about progressive every day, progressive every week. It's a little jump, tiny little bit, once you're symptom free for a couple weeks, okay, and you've been able to be successfully paced. And what we found is that some people will start realizing, oh, okay, now I can shift to more of that progressive exercise strategy. The challenge is we don't know anything about who is going to be an individual that can do that, what the predictive factors are, you know, is there more people with more fitness or people with, you know, less severe diagnosis, things like that. All of those things we don't know if they predict who's going to turn the corner to be able to do more. So the idea is, again, when your symptoms improve, you'll have less weakness and fatigue. And again, this work with your healthcare provider and see if you can very gradually increase. But that increase, again, is not a progressive increase. It's a tiny little step and stay in pace. Then maybe a tiny little step and stay in pace, again, keeping symptom free, okay? So one of the big things in the stage before you get to that turning of the corner is focus on your accomplishments instead of your symptoms, right? What have you been able to do? Maybe your symptoms, you know, you've been able to keep them at bay, that's good. And you're finding that over time, you know, you're able to do a little bit more. Again, be very careful, work with your healthcare provider, because again, the progressive increase strategy doesn't work. So think about, I'm staying at a different level for at least a 2-week period and be symptom free before I think about going up a little bit, okay? Again, I mentioned heart rate monitoring, and that's not one that I'm going to teach you today because, again, beyond what I've already said, because it does require working with a healthcare professional to be able to get it right. So definitely seek out help for that. So I promised some resources, and there are several good resources. These are just a few that I've pulled up for you. Now, this one from the Physiotherapy Association, Canadian Physiotherapy Association, is one that rehabilitation professionals across Canada put together for clients with post-COVID condition or long COVID. I was an author on this particular work, and it's a guideline for Canadian professionals in rehab to help with guiding them in terms of what to watch for, how to screen, and it has really good links for your healthcare provider to look at different screening questionnaires, different articles and publications that support what they're saying, and it's a really nice resource. The ones that I used today weren't those though, they were these information sheets. And so if you go to this link, world.physio/toolkit World Physiotherapy Day or PT Day 2001. I'm not expecting you to write this down right now. What we'll do is we'll plan to give this to you to attendees afterwards, or maybe link it to a page that where this webinar is going to live, so that you can go and find these. And again, I would highly, highly, highly recommend having a look at them. Take them to your healthcare provider. And ask how you can progress and how you can get involved with rehab programs. And then also a briefing paper that's along the same lines is more of a paper version if somebody's more into reading some of the research and some of the things in more detail there. In terms of other resources, there are in Saskatchewan, there are very, very little or very, very few clinics that are specializing in COVID at the present time. I know that the Saskatchewan Health Authority is working through a COVID rehab strategy. As of the timing of this webinar, it hasn't been developed yet. They're still working through it, and you know, in the near future, hopefully there will be some information that you can access in terms of a pathway to see a physician or to see a specialist and figure out how to do your rehab. If you do a quick Google search of physiotherapy clinics in Saskatoon, or if you happen to be in Regina, you could search that as well, because I know there are a couple clinics that are starting to do COVID rehab or long COVID rehab, and you could find some individuals there. And then certainly the chronic disease management and rehabilitation teams throughout the Saskatchewan Health Region or Saskatchewan Health Authority have the exercise staff that can help you. But again, provide these resources to them if they haven't specialized in long COVID, to understand that if you have fatigue, your responses need to be very, very different than those that don't have that post-viral fatigue. Again, there's not a lot of research at this point in time. Hopefully a year from now, most of you have at least recovered some of your symptoms and don't need to access this information, but maybe a year from now, we will have more information on exactly how to approach long COVID rehab. A couple plugs for some support groups online. These are two Facebook groups that are very, very good. If you happen to be on social media or are willing to go onto social media, these are on Facebook. You can find them by searching the name. This one is a Canadian-wide group with, as you can see, over 14,000 members. And there are a lot of really good discussions on these groups around resources, and when new research comes out, they're posting them. And then, of course, the Saskatchewan Lung Association COVID support group that is rapidly growing. We're still, sitting at 116-ish, but rapidly growing. I would encourage you, if you're not on this group, definitely get on this group. Lots of good Saskatchewan-specific resources that are being put out there. And if you watch that space, hopefully you'll be able to see some more calls for research participants and for individuals looking to contribute to research on this area, so that we can help develop our guidelines and our strategies, and so that we can, as researchers, best help you with your disease and your progress. So with that, I'm going to say many thanks to you for being here and to listening, and hopefully you were able to get something significant from this webinar, and I'm very, very happy to answer questions. We're going to open it up on the floor fairly quickly here for questions, but also you have my contact information from the beginning of the slide or beginning of the webinar, that you can always contact me afterwards. So anyway, thank you all, and thank you, Jill, for hosting, and I'd be happy to take questions.
Thank you so much, Dr. Butcher, for that amazing presentation. Certainly, I learned a lot, and I think it was really great that you emphasized that not always progressive exercise is the way to go, and that pushing ourselves you know, which we often think will make us stronger, and stronger can actually do some harm. So thank you so much, and thank you for sharing all those great resources. And yes, when we share this webinar recording, we will also include the links and the recordings as well. So, and the resources, sorry, as well. So thank you so much. All right, we are going to start into the question and answer period. So if you haven't already done so, and if you have a question for Dr. Butcher, please go ahead and type your question into the question feature. Don't be shy. Like I said, chances are you're not the only one that is wondering whatever you'd like to know. Okay, so we've got a few here to start. The first question here is, this is an individual that had been diagnosed with COVID-19, specifically the Delta variant, in the summer. They took a few weeks off the gym. They normally attend a CrossFit program, and they tried, you know, taking it easy. And then when they felt like, you know, maybe that they could push a little bit harder, they increased the intensity, and they felt a heaviness in their chest. They don't, previous to having COVID, they never had any type of pre-existing health condition. So what would you recommend as far as their exercise regime and any tips for them moving forward?
Great question. Yeah, and thanks, Jill. And if everyone's still on the call noticing, I changed my shirt super quick after the webinar so that I could recognize that we're the importance of the Truth and Reconciliation and the Orange Shirt Day that's tomorrow. But anyway, to the question. It's a great question, and there's not an easy answer at this point, because we know that everything that happens this way is so individual. Everybody's symptoms respond differently, and everybody's time frame for recovery is different. General things that I would encourage you to think about if this is you, or if you have something similar to this. You know, if you took it easy at the beginning when you restarted and your symptoms were okay, that's probably a decent sign that you know, that you're probably not in the category of having the post-exertional malaise, but that I wouldn't necessarily discount that. So what you need to do is look at the length of time since your diagnosis, and you've said that it was in the summer, but then you were having sort of a heavy lung feeling a few weeks after kind of getting going and restarting. It definitely could fall into that phase of being long COVID, of course, and then having the potentially having this crash or push and crash response. If you were just feeling a sense of heaviness in the lungs, I don't think that really describes what we think about when we think about this push and crash. So I'm going to go under the assumption that you're not in that post symptom exacerbation category, and if so, it could be a combination of the increased viral load that causes sort of some acute fatigue. You should get assessed to see if there's any primary organ damage. If your lungs are feeling heavy, why is that? Is there something going on with your heart? Is there something going on with your lungs? Is it just deconditioning? Is it just recovery? And see how things go over time. In terms of what do you do today or tomorrow, I would just keep the intensity under what we would say as a symptom threshold. So if you're starting to feel whatever COVID related symptoms that you have while you're exercising, your best bet is to do something that's a little bit below that, so that you don't get those symptoms. And again, this is assuming that you're not doing the push and crash. If you got the crash where you were laid up in bed for days and days and days afterwards, or really had that that significant crash, that's a different story. But if you're kind of just feeling some heaviness in the lungs, just take it easy. We, especially CrossFitters, being a CrossFit certified trainer, I know that CrossFitters like to push. Don't push. You know, take it nice and easy and think about slow progressive increases in intensity, again assuming that you're not actually crashing, that it's just the symptoms that are coming on. So without knowing more about your individual situation, it's hard to give you more info than that, but hopefully that helps give you some guidance.
Perfect. Thank you, Dr. Butcher. That was helpful, I think. Okay, so we had a few questions, and this was actually sent in before the webinar. What about respiratory devices that are set to either help inspiration or expiration, the strengthening of the lungs? Something like the breather or Aerobica, that's more of an airway clearing device, but there's several devices on the market now. Would anything like that assist people in strengthening their airways and help in getting back to activity and exercise after having COVID?
Great question. Right now, there is, and I just as this question came up, thank you for providing it ahead of time so that I could just have a look. There is zero research on that, and again, this is not surprising given how new everything is and the rehab is. My feeling based on the experience, anything that's an airway clearance device would only help you if you have secretions or mucus that are built up, and that's really going to give you most of the effect because of that. In terms of the resistance devices, so the inspiratory or expiratory muscle trainers, again, I think it depends on what the damage is and what sort of presentation you have. If we're talking about the long COVID presentation that involves fatigue, I would suggest that this should fall into the general category of activity. And if it's something that you wanted to try, really take it easy, build it in within your day to have lots of rest periods, and you could see if it has an impact on you. If it's the case of someone who is deconditioned or someone that is going through pulmonary rehab or cardiac rehab, there's some really good evidence that that can help for certain individuals, and there's really not a lot of downside for those individuals in terms of doing something like that to help. But again, just anything you're adding in, if you fall into the post-viral fatigue category, you have to be think of everything that you add in as something else that's going to draw more marbles. And do you have enough marbles for the day? Are you spreading things out? Those are the things that you need to think about.
Yeah, absolutely. Thank you. That was helpful. Yeah, you don't want to lose all your marbles.
Nope.
Okay, so here's a really great question as well. Since COVID, I'm using my upper airways to breathe. I'm aware of this, and this is definitely the case in the same when I'm on the treadmill specifically. I try to walk on the treadmill for about 30 minutes each day. And some days I end up coughing and gasping. How low should my oxygen levels drop while exercising? I do try and stay within my target heart rate.
Okay, complicated, but very, very good and important question. So when you say that you're breathing with your upper airways, I'm going to assume what you're meaning is you're breathing what we call apical breathing, where the breathing pattern is moving here in the chest and you're doing this, as opposed to diaphragmatic breathing, which is the low belly push out inspirations that you would get. So if I'm making that assumption incorrectly, then I apologize. So there's multiple facets to this. So one, we can retrain breathing patterns, and that's something that I think is underutilized in general population, and I think could be very helpful for someone who is trying to progress their exercise. Again, on the case where progressing exercise is a good thing, right? So not the post-viral fatigue sort of in the push and crash situation. So retraining breathing is there's a couple things that can help with that, because it is a natural thing, especially if you're struggling and if COVID has sensitized your airways, which is one of the things that we find is that a lot of the sensations of dyspnea are happening because of sensitized airways. And so when you're breathing deeply, you can have some exacerbation of those symptoms. So you can have sort of a cough kind of sensation, almost like you would hear a chronic bronchitis individual or someone with asthma if they're wheezing and coughing. It would sound sort of similar to that. So if that's kind of what we're talking about, we we don't know the course of that, but hopefully that recovers on its own with time. But make sure that if there's any medications you need to be on, that you're talking to your doctor about that. But in terms of retraining the breathing pattern, there's a couple things that can do. One is it can take the sort of the onus off of these muscles that are involved with expanding the lungs and the airways up here, which are, we call accessory muscles, and they're not really designed to do that very much. The diaphragm, your belly breathing, is really the most efficient way to breathe, and so you can improve your efficiency, which may improve your overall sensitivity and the amount of ventilation going back and forth. The second thing that does is we know that what's really evolving is that there's what we call an autonomic dysfunction that can happen with patients who have had COVID or are progressing into long COVID. And so that's really what that means, is that's an over-reliance on your stress responses. And so if you've probably heard someone at some point in time talking about fight or flight versus rest and digest. So your fight and flight responses are very much heightened when you do things that mimic that kind of exercise or activity, and so apical breathing is one of them. And so if you can retrain your breathing to be more efficient with belly breathing instead of this upper airway apical type breathing, you can actually shift yourself a bit from the fight and flight responses and maybe spend a bit more time down in the rest and digest responses, even while you're exercising. And so that changing breathing pattern can be something that again, no research on this. This is just anecdotal. This is just sort of clinical judgment, thinking about this disease and what we can potentially do here. There is good research on changing breathing patterns in these other post-viral fatigue syndromes, where there is autonomic dysfunction that we see that changing breathing patterns can make a difference. In some people it's a big difference, in some people it's a little difference. There was another part to the question that was talking about how low should your oxygen levels go. Keep in mind, first of all, that feelings and sensations of shortness of breath or feeling heaviness in your lungs or that, really there is zero association between those symptoms and how low your oxygen levels are. The mechanisms are completely different. So if you feel like you're breathing heavy, don't automatically assume that your oxygen levels are low. What you need is a pulse oximeter. So you need a finger clip or an ear clip or a headband that it's designed to measure your oxygen levels. And if you have one of those, then in general, we say that a safe zone is anywhere 89% and above. Now, 89% is still a clinically significant result, but you're not going to be unsafe exercising at that level. Normally, we see oxygen saturations during exercise kind of around the 96 to 98 range. If you have a clinical lung disease or some sort of disease that would reduce the oxygen saturations, it is normal for it to decrease more than 4 or 5%, but don't go below 89 or 88. That would be the key thing. If you are going below 89 or 88, you definitely should go see a physician, try and get a referral to a respirologist and figure out what's going on with that. Was there anything else to that question, Jill? I can't remember. So I remembered those two parts, but I couldn't remember if there's anything else.
No, I think you covered it all. You talked about the oxygen, and you talked about the symptoms that they're experiencing, the cough sometimes. So no, I think you covered it all, and I'm grateful as well that you mentioned the importance of diaphragmatic breathing, and sometimes there can be a change in breathing patterns. We do have another webinar for the public coming up the end of October on the power of breathing and utilizing the Radcliffe method with Donna Turner. So if you are interested in that, there will be another webinar specifically on that topic. And you can just register on our website at lungsas.ca. So
I'll be there.
Very good. You're always welcome, Dr. Butcher. Okay, I have another great question here. So you did mention pediatrics and some children, specifically children experiencing long COVID symptoms, similar to adults and about the same frequency. Do you have any further resources for pediatric long COVID rehab and treatment strategies, and if a pediatric approach would be any different maybe than an adult approach?
Great question. Short answer is I don't have specific resources. It is possible that they're out there and I'm not aware of them. I am going to go out on a limb and say if there are resources, or if there are resources, there are very, very few of them, and probably there isn't anything that would be specific to that. Just knowing what we know, everything has been everything is so new and things are just evolving now. What I'll do though, Jill, is I can do a quick search and see if I can see and find something. And if I do, what we can do is we can put it on the site with the rest of the resources.
Absolutely, thank you. Yeah, you're always great at finding evidence-based resources. We always appreciate that so much. Okay, has there been any data on long COVID symptoms after a person has been fully vaccinated? So they're fully vaccinated, they test positive for COVID. Do you know if there's any data of those individuals having long COVID symptoms?
Little tiny bits, and it doesn't directly answer that question. So again, just knowing that question a bit ahead of time, I did a quick search that way as well, and into the literature, and there really isn't anything definitive. So I guess there's two sides. There's you're vaccinated, you get COVID, and what happens. But then there's also the side of I had long COVID or I had COVID, got vaccinated, my symptoms changed. Lots of anecdotal evidence on that. People saying that the first dose they got better and the second dose they got worse again, and some people are vice versa, and some people just got better and some people just got worse. But in terms of your specific question about those that are being vaccinated and then contracting COVID, there is just a small little bit of evidence right now suggesting that because the specific cells that go into causing some of the underlying factors associated with developing the symptoms change and are different and respond differently. And this is me as the non-virologist talking. So, but in terms of what I read, there is evidence to say that the symptoms are likely less. But beyond that, I don't think we really know. I don't think we know about the prevalence of long COVID in those that are fully vaccinated. I mean, this is again something that's extremely new, so we don't have that. I think everybody's responses are a bit individual as well. So unfortunately, I can't give you a good answer to that one.
No, great. Yeah, it's the research and evidence is evolving, and we learn something new each day, don't we?
Yeah, absolutely.
Okay, so here's another great question, and this was sent in early on in the webinar. When starting exercise, so you're just starting out and you're trying to start a progressive exercise program, would you suggest starting with cardio, like walking, or strength training, or a combo of both, right?
Great question.
Start. So
Yeah,
they're just beginning.
Yeah, absolutely. Great question. This again is under the assumption, just for clarity, that we're not seeing this post-exertional malaise and the post-viral fatigue, because again, that's not something that we're going to use the progressive exercise response until someone turns that corner, if they do. Assuming that you're not one of those individuals, let's say you're deconditioned or you've got some hospital-acquired weakness, that sort of thing. In general, I'm a big proponent of strength training, as I mentioned in the first part of the webinar. Having said that, I never recommend a program that doesn't involve both. So my suggestion would be, if you're not walking, start walking. And walking can be your only aerobic exercise. You don't need to think about eventually, progressing to running, things like that. It's possible, and if you want to do that, that's fine. But the data on health responses for someone starting are that really you just need a walking program that pushes you a little bit, and raises your heart rate, and you meet 150 minutes a week of getting your heart rate up. That's usually good enough for the aerobic side of your health. But what it doesn't do is it doesn't help you prevent muscle mass loss and prevent that sarcopenia that I mentioned. It doesn't help you prevent muscle strength loss, which happens with aging, and certainly with deconditioning as well. So if you're trying to build yourself up, I think you need a multi-pronged approach. So I would do both. I would do some light intensity walking, and at least 2 times a week of doing some strengthening for the major muscle groups. And that's easy enough to go do in a gym. But if you need further help with how to do that and what's most efficient and best ways to do that, there are lots of good personal trainers and strength coaches and other resources that you can go to help to learn how to do that more efficiently or more safely. But both of those activities are appropriate for a true beginner, are appropriate at the beginning stages of rehab, again, assuming that we're not in that post-viral fatigue, and are safe. And the evidence is very clear that they are safe, and as long as you're progressing appropriately.
Perfect, thank you. Great answer, and appreciate that very much. And then maybe some stretching too in there, right? Why
Sure,
not?
absolutely.
And mindfulness.
Yeah, I wouldn't throw that. I didn't talk about mindfulness today. It's one of my favorite topics these days. But the mindfulness, along with having an impact on the autonomic system through your breathing, and the combination of those things, I think is massively powerful. And I'm hoping to start a trial in long COVID with that. Looking for some funding still. So hopefully you'll see something related to mindfulness in COVID soon.
Yeah, that would be great, and definitely do keep us posted at the Lung Association, and then we can share with all of the people on the webinar and our COVID-19 support group as well.
Absolutely.
Okay, I have another question for you, Dr. Butcher. Are there long COVID symptoms or long haulers does this happen in people who are fortunate enough to maybe just have mild symptoms when they are considered in the active phase of having COVID?
Yes, yeah. So it's sort of a catch-22, and there are reports, absolutely, and this again isn't something that has been really documented through research findings. This is just reports of listening to those on social support groups, where they really just had, as I said in the webinar, really mild symptoms, and really didn't have any significant concerns in the acute phase. But then in the long term, they develop these post-viral fatigue symptoms, and then just can't kind of push beyond that. So that has been shown in, again, anecdotally, in terms of just talking with people. And then the reverse is true as well. You could have very severe symptoms at the beginning, recover from them, and then don't have long-term symptoms. So I think the big takeaway is that the presentation is very individual, and you can't say that just because you had a certain degree of severity at the beginning means that you're absolutely going to have or not have long COVID type symptoms. It's just, it does happen in basically that direction, but it happens in all other directions too.
Okay. So not necessarily what we would assume, right? Doesn't mean that if you were only hospitalized or in ICU or very severe in the acute phase, that you won't have any long-term symptoms. So not necessarily what we'd assume. That's good to know. Thank you.
Yes.
Okay, so this is a little bit of this might be a difficult question to answer specifically, but generally speaking, for individuals that have had long COVID symptoms, and for individuals that have had to pace themselves, what do you recommend for people trying to gradually go back to work? So they've been off for a long time. So it's not just about, getting in more exercise, but just trying to get back to their normal life. What would you recommend there, generally speaking, knowing that each individual is very different? And it probably also depends on the type of job that they do.
Totally, and that is exactly the answer. Is that it does depend, and I know that we all want more information than that, but because it is so individual and it does depend on your job and your job requirements, that it is very difficult to answer. You're right. general advice I have, and I haven't worked in a situation where I've been involved with returning people back to work in terms of the insurances that are associated with that, and sort of the mechanisms that are beyond that. So I don't want to step out of my wheelhouse that I'm in right now and out of bounds. But generally, I would think that you have to consider how increasing your activity, how you're going to respond to that, and how that fits into your entire day, keeping in mind that pacing and prioritizing and planning is really going to be a big part of that. So what we're finding with some individuals, and again, these are just reports of some of the early findings from some studies of investigators that I've spoken with. It's also from talking with patients with long COVID that are being successful at kind of turning the corner from pacing, is that you really have to look at it as a symptom tolerance. And if you are doing something acutely that causes symptoms, you've already done too much, you might have pushed, and then you might crash. So it's a very difficult thing to say, and because the other issue, as I mentioned in the webinar, is we can't predict who's going to turn that corner and when. So we're looking for stability of symptoms, and that's really going to be the biggest thing, is that if you are pacing and your symptoms are stable, and some people have said stable for a week, I think that's too short. I think you need to be stable for at least a couple weeks, if not longer, before you try and say, well, could I pull a few more marbles from my jar? And remember that as soon as you start pulling more marbles, that then takes you to mimic the progressive exercise response, where you do something one day and then do something more the next day. And we really have to be careful with that. And you might draw a couple more marbles and then try and stay at that level as long as you're being symptom free. But if you're starting to get those symptoms, you do have to back off. So maintaining that symptom tolerance and planning it throughout your entire day and week to be sure that you're not exacerbating your symptoms and you're not involving a crash, I think would be of paramount importance for you when you're thinking about adding anything in, whether it be returning to work or anything else. Okay. But I can imagine, or I can't imagine because I haven't gone through it, but I very much sympathize for the individuals that are listening and those that I've spoken with that are in these scenarios where it's extremely frustrating because you just, the way that life has worked in the past does not work now. But hopefully with good progress, good pacing, and keeping your energy levels under check, keeping your symptoms under check, hopefully we can get people turning a corner, or at least figuring out how to best manage the situation that they're in. But I understand how incredibly frustrating that must be for people.
Yeah. Thank you for that. And yeah, I hear you. There's, it's life as it was before isn't how it is now, and it isn't all black and white. So thank you. Pacing though is challenging, right? We're trained to push ourselves. Okay, so this is another question here. We've just got a few minutes left. I want to be mindful of everyone's time. Hi, Dr. Butcher, fantastic presentation. I'm a physical therapist, and I'm wondering if in the literature that we have, there's fairly good distinction between the post-exertional malaise versus general deconditioning / organ damage in patients and treatment approaches. And they're asking primarily for the purpose of trying to communicate I believe, with some potential funders and recommending treatment programs. I think they're really trying to help people that are struggling. So they're just wondering any advice that you have there.
Yeah, great question, and shout out to the physios on the call, and thanks for the question. But it's important work that needs to happen, but the work hasn't happened yet, and we are borrowing from the literature of other diseases in other circumstances And the distinction has been, that I've presented is one that has been made, but it's really at the clinical level and the anecdotal level. It really hasn't been in terms of, there haven't been any randomized controlled trials that have looked at progressive exercise versus pacing, for example, and when to do what and how to progress. And we're really borrowing a lot from what we know about Icu Acquired Weakness, what we know about cardiac and pulmonary rehab programs, and then what we know from the myalgic encephalomyelitis literature, the chronic fatigue syndrome literature, that really they still don't have it figured out for them. But that's where the pacing kind of concept comes from. But again, it's not something that's well documented in the literature. So I would say that you can reference any of the resources that I've linked at the end of the presentation, and it'll be on the website. And just keep watching the literature and see what evolves, because there isn't a great publication that says this is what we need to do. It honestly doesn't exist, unfortunately. In a year, like I said in the webinar, in a year's time, maybe we might have something like that, but it doesn't exist right now. So we are borrowing from the literature of others. Feel free to contact me directly if you want to talk about this in more detail about your specific situation, because I can certainly help give you more advice when we have more time.
Okay, thank you. Thank you, Dr. Butcher. So we have about 1 minute left here. Really quickly, there are a lot of people on the call with different experiences. Many of them have one thing in common. They're concerned about their future. Any words of hope that you can offer them?
So I think the bleak message of we don't know what's going to happen is also a message of hope, in my opinion. I think that a lot of individuals that let's say go back to the chronic fatigue syndrome type individuals, they've taken so long to get diagnosed that any chance of really recovering through proper pacing early in their rehab programs, and then maybe hopefully turning that corner, probably has already passed. The good news about us looking at this when it is so early is that I think there is some hope. We are seeing people in probably higher levels of prevalence than those in the chronic fatigue syndrome world that are starting to turn that corner. And so I would encourage you, like, life is precious, life is beautiful, life is wonderful. It doesn't feel like it right now for many of you, and I do understand that. Keep pacing, keep patient, keep your supports with you. Try and look at things that bring you joy and try and incorporate those into your life. I think that we are going to get there. We're going to be able to answer some of these questions. Just have some patience and focus on your pacing and just try and live at this new normal. And it's terrible to say, and I don't like it, because I would not feel comfortable with that myself. I would not want to live at that level. I would want to be able to go back to normal. But at the same time, think of it as living within your financial means or your marble means, and do the best you can that way. And hopefully, I have hope. I know, Jill, I can see in your face, you have hope that we are going to have enough knowledge going forward to be able to figure out how we can get people to turn that corner sooner, faster, and more effectively.
Absolutely. Thank you for that. Yes, we at the Lung Association, our goal is to help people breathe easier and feel better, and we definitely hope that we can continue to help all people living with lung disease, but people as well that have been diagnosed with COVID-19. So that is all the time we have tonight. Dr. Butcher, I can't thank you enough for this wonderful presentation and for sharing your knowledge with us and your resources. We will, this webinar has been recorded. We will be posting it on the Lung Association of Saskatchewan's website, lungsas.ca, as well as emailing it out to everyone that has registered, and we'll put up those resource links as well. We definitely want to acknowledge and thank our incredible sponsor, and Marie-Claude, the good people at GSK. Thank you so much for making tonight possible. And if you have had COVID-19, or if you have a loved one that's had COVID-19 and struggling, you're not alone. Please consider joining, if you aren't already, our Lung Association of Saskatchewan COVID-19 support group. We'd love to have you. There's information on our website at lungsas.ca. And as well, please consider making a donation to the Lung Association of Saskatchewan, so we can continue helping everyone in the good people in this great province breathe a little bit easier. Thank you very much, everyone. Stay well,
Thank you, everyone.
stay safe, and good evening. Bye.